One of the most common things that I see just walking into offices, when I get to the first point of just speaking with receptionists, it's almost unreal, uncanny how many of the receptionists themselves immediately, when I say I'm there to talk about TMJ, immediately they chime in and go, "Oh, I need to come see you." And I'm like, well, you've got your referral form right there. So it's so common. And then again, just like you, when I do the lunch and learns, inevitably someone in the office mumbles. I hear mumbling under their breath. Oh, I've got that. And so, while we say 45%, I almost would say I would believe it's probably even higher sometimes. It's really is unbelievable that even people in dental offices, I mean, we're all trained. We know about TMD, but a lot of the assistants out there, a lot of the staff are suffering from the same thing. It seems like it's just not as commonly connected or diagnosed, even in dental offices. I think it's probably twofold. I think it's a lot of times dentists don't know. That's not their forte. That's not something they do. They're doing crowns and bridges. They're doing fillings all day. TMJ is not necessarily something that that they would have a patient, coming in all the time for. So it's not something that everyone knows about. They don't know about all the symptoms. And I'm finding that routinely, that sometimes dentists will look at me, or medical facilities, the physicians will look at me and say, well, I really didn't know that vertigo was tied to TMJ. I really didn't know that you could have numbness and tingling in the fingers, or, pain in the neck. I really didn't know that those symptoms were associated. So, I'm fascinated just being out there over a year, and I have a background as a dental assistant, even for over 20 years, but it's still, from that perspective, working in a dental office is not the same as going out there from an outsider talking to these offices, and you see how common it is. You see quite often that people just are simply not connecting the dots. The dots are there, but they're not connecting those dots. And that's where I feel like part of my job is to come in and educate them about that, because it is very prominent.
Yep. Well, you definitely are having the same experience that I had. Good fortune